Hi, my name is Dan Spector. I'm a retired real estate appraiser, and Dr. Gupta performed a robotic prostatectomy on me. I came to Dr. Gupta by way of a second opinion. About a year ago, I had what I believe was a botched aquablation procedure. I had a lot of complications, a lot of blood, a lot of pain, bladder spasms. It was just horrible. And then months afterwards, I didn't have very good urine flow. Um, I, Dr. Gupta was highly recommended. I came to him, and from my very first visit, I could tell he was very confident, very warm, and his confidence, as it turns out, was well earned. He did some preliminary tests on me and showed me right there in the office that I had a prostate blockage from scar tissue from the previous procedure, all likelihood. Um, he said right away, you really have to have this done. You could do long-term damage to your bladder. So we went forward. I had some trepidation, but he kept me confident through the whole process that his process of going through the bladder and actually pulling some of the bladder tissue into the urethra would keep me from having so much blood and keep me from having so much pain. Well, he was right. Uh, my first coming out of the procedure, I had no pain. I couldn't believe I didn't have any pain my night overnight. And when he came to visit me the next day, I said, "I'm not having any pain. I can't believe this." Um, so he said, "Well, you might still have some pain. You might still have some blood. So, just be careful." He released me. In the first couple of days on the catheter, I had some pain, but the bladder spasms were much lower. That my tendency is to get that anyway. But my symptoms were much calmer, much more tolerable. And by the fourth or fifth day, I almost had clear urine, very little blood. And so when I finally had the catheter taken out in his office, my wife was there, and it was a miracle. The flush of urine that came out, we both sort of, as soon as Dr. Gupta came in the room, my instinct was to give him a big hug, and then my wife jumped up and gave him a big hug, and we were just really happy. So I can't recommend Dr. Gupta, his support staff highly enough, his anesthesiologist, everybody in the front desk, all of his residents. So you're in good hands with Dr. Gupta. That's all I have to say.